details they might get, that there's always concerns related to that. So people want to know, is my doctor covered? Is my healthcare system in? Or what are the changes? What kind of an impact does that have? And so we want to address stability in a couple key areas. One of which I'm pleased to say is actually getting voted on by the legislature this week. It passed the Joint Finance Committee last week on a bipartisan basis. And it's really trying to address a very unique challenge that people have. You talk about plans. One of the things that, kind of explaining, I explain it in more layman's terms, but when it comes to healthcare, most people in this state get their healthcare one of a couple different ways. The vast majority of us, like myself and my family, we get our healthcare coverage through our employer. That's called a group plan. And the vast majority of people in the state are in that category. Thankfully, group care or group plans have had less than 5% premium increases this year, and that's because of a lot of good quality work to provide not only great health care, but to do it at reasonable cost, and for that we're greatly appreciative of the healthcare systems of the state. There's another group of people, like my parents, who are over a certain age, that get their health care through Medicare. That's for people over a certain age, and that's something the federal government provides, and certainly we appreciate that, the good care that our seniors get here in the state of Wisconsin. But then there's another group. Out of 5.8 million people in this state, there's about 200,000 individuals that get their care, typically small business owners, people who work in small businesses, and a lot of family farmers who get their health care coverage from individual plans. And the challenge there has been this year, we see that insurance on the individual market has gone up on average 36%. In fact, in some places it's gone up far more than that. I introduced a young woman from Brown County, so a little bit further away, but Brown County at our State of the State address, who literally saw her premiums on one of the plans under the Affordable Care Act exchange go up by almost $2,000 a month. That's just unsustainable, and it's unacceptable. And so we looked at ways that we could help drive those numbers down. What my goal was, in working with our team, was to say, help us find a way to get premiums at or near on the individual market where people are at the group market, figuring kind of have it all be similar and the same. And so what we've proposed and what the legislature is voting on, I actually talked to the U.S. Secretary of Health and Human Services a bit about it this morning, and I'll be meeting with him in person over the weekend at the National Governors Association in Washington, is what we call reinsurance. And what that really is taking a portion of the high risk that insurers have to cover in the individual market, putting money aside to help draw that risk down. We do it putting $200 million of Medicaid funds into the system, 3/4 of which come from the federal government under what we're totally qualified for. The other quarter comes from some of the efficiencies we built into our systems here in the state of Wisconsin. So there's no new taxpayers' money. We can do it under both the federal match and the dollars that we have. And the beauty of it is that $200 million drives the risk down so that premiums will be at or close to where people at the group insurance levels at. So we'll see consistency in terms of premiums. That means premiums will go down dramatically for people in the individual market. That is not only good in terms of reducing costs, but what we believe we'll do is introduce even more plans. We want to re-enter the marketplace because we're not at all across America, particularly in rural areas. The challenge has been under the challenges with the Affordable Care Act, so-called Obamacare, has been that many insurers have moved out of markets, particularly in rural areas. This will help us attract more back into the state. That'll be good not only for prices for the consumers, but also it'll be good for choices that those consumers will have. Now, there's two other parts to this plan. One other additional part that applies to everyone, whether you get it through an individual plan or get it through your employer, through group insurance. Really, for everyone in this state, one of the other concerns that I've heard is with all the talk about what may or may not happen in Washington, there's a real concern about pre-existing conditions. And so we've asked the legislature to pass a law that makes it abundantly clear, no matter what happens in Washington, D.C., that pre-existing conditions will be covered. So whether someone suffers from cancer or some other serious disease or ailment, no matter what their circumstances, they'll be completely covered in the state of Wisconsin. That's particularly important because right now, we don't know what the next step is. A lot of people talked about changes they were going to make to healthcare at the federal level. A year later, that hasn't happened. In my mind, Washington has failed. Again, Wisconsin's going to lead. And for us, part of leading is making sure that no one's left behind, that everyone with pre-existing conditions should have access to healthcare. And the third part, again, for seniors, people like my parents, again, they get their health insurance under Medicare. That's a federal program, but for years we've had a wraparound to help lower-income senior citizens get access to affordable prescription drug care. And that's something that has gone back about a decade and a half. In fact, starting in 2002, Every 4 years, we've asked for a waiver from the federal government. We're asking the federal government to make this permanent. We're not going to change it. We're going to keep it going forward. There's been debate about whether it should be federal or state funded in the past. We said, let's just make it permanent. Let's provide peace of mind and certainly and stability for our seniors to know that if they're able to qualify, that program is going to be there forever. And so all these things are really ultimately about stability. We have seen, and we were waiting to see if the federal government was going to make some changes. The House took some action. It seems that things get hung up in the United States Senate. And so until there are changes there, we need to act here in the state of Wisconsin, and that's why we're pushing it. We're pleased. Again, the Joint Finance Committee passed it last week on a bipartisan vote. Our hope was the State Assembly and the State Senate will do the same. We'll act on this quickly and then go forward and get this implemented as quickly as possible so that going into this next year, hopefully can drive premiums down. At the same time, we can ensure that everyone with pre-existing conditions has access to health care coverage. So with that, I'll take questions if you guys got it.
Governor, as you know, many counties on the in the